Hospitals are a foundational part of our health. Whether it's our annual checkup or a quick run to the emergency room, many of us rely on the healthcare system to keep us well. However, in his new book, Me versus Us, A Health Divided, Dr. Michael Stein thinks we may be depending too much on medicine.
This book is really a critique of all the things that we're missing when we focus entirely on the healthcare system. It's remained a beginner on how to measure the quality of the care that we deliver, and it continues to leave out of insurance, which is part of the healthcare system in the United States, 20 to 40 million Americans, depending on the year.
Stein is a primary care physician and professor at Boston University School of Public Health. He says the first issue when discussing public health is that most people falsely assume it's just another synonym for health care.
You go to any party or bar or have a conversation and you bring up the word health, and a person will immediately start telling you their latest doctor story. So that's healthcare. They turn right to doctor stories.
Public health, on the other hand, addresses preventable conditions such as obesity, alcoholism, and gun violence. Stein refers to public health as all of the actions we can take before needing medicine or hospitalized care. He often uses soccer as a metaphor.
So I think of health care, that is the medical system, as the goalie. The goalie is healthcare, which is you want to have a good goalie. If somebody shoots on your net, you're the last line of defense. But most of the game is played out in the field by the other 10 players. And the goal for those 10 players is to keep the ball away from their goalie. Never go to the goalie. That's a great game, right? Never have your goalie make a save.
The other 10 players are public health, all the lifestyle factors we can control to keep us healthy. However, our current use of the healthcare system is like we've benched the rest of the players, relying solely on our goalie to protect us. In fact, we annually invest about 40 times more money into healthcare.
We spend $11,000 per American per year for healthcare. So that's doctor visits, hospitalizations, medications, x-rays, tests, etc. $11,000 per person per year. On what I would call public health, we spend $285 per person per year.
Stein says our real goal should be to use medicine and doctors as a last resort.
It's lovely to have a good doctor. We want that. We have good doctors in the United States, but the goal should be to keep the game away from your goalie. And so public health is all about those things that create health in the United States, that keep us healthy. And they are the things you think about: food and water and pollution and politics and discrimination and poverty and all of the sort of big issues that we face, some of us more than others, depending on the issue, on any given day in the United States. And that's public health.
Unfortunately, Stein says it's something we've continued to ignore. He looks at life expectancy as one measure of overall health, noting that the rates in America have become drastically different than some of our European counterparts.
In the 1990s, the average life expectancy for an American was pretty much the same as it would be for a person living in Europe. And now, American babies are far more likely to die before they turn 5 years old, and American teenagers are far more likely to die before they turn 20, and American adults are far more likely to die before they turn 65 than almost any country in Europe. In other words, Europe has just better life outcomes than the United States across the board.
Stein argues a big part of the issue is that our society values medicine more than actual health.
Why are we spending $11,000 when we've reached the goalie, when we're already sick and we have to go into the hospital? And why are we not spending more than $286 per person on doing things like instituting policies that can change the way we remain healthy?
In an effort to address a main public health issue, President Biden recently hosted the White House Conference on Hunger, Nutrition, and Health. The first Hunger Conference was held more than 50 years ago, and people like Dr. Franchell Hamilton are happy that policymakers are finally revisiting this topic.
It's never been like high up on their list, and now I think they're realizing that this is a real issue and it's so bad because the medical problems are so bad. They've had so many studies that come out recently that have shown that there's deaths in heart disease and related cancers purely related to our food.
Hamilton is a bariatric surgeon, obesity weight loss specialist, and founder of NeuroSwitch Weight Loss. She says this year's conference aims to provide healthier and more affordable food through several different strategies.
One is they wanted to essentially make government funding of food to include more vegetables and produce, not just kind of some of the typical things that they're able to get on like some of the known like WIC programs. They also have a lot of other programs that they want to introduce in the school systems to make food more affordable. They would like to make free lunches, if possible, across the states for children, because a lot of times when they go to school, that's the only time they're able to get a meal for some people. And so they're wanting to be able to make that an option to be free.
Many of this year's ideas expand on the outcomes of the first Hunger Conference. Hosted by the Nixon administration, that meeting pushed for the labels that come printed on all of our food today, as well as many fast food chains providing ingredient lists for consumers. In an effort to build on these practices, Hamilton says this new conference focuses on the communities most in need.
A lot of the changes that they want to make specifically focus on underserved and minority communities, because that's where we're seeing the higher ratio of medical conditions. And so they are targeting programs specifically for those communities. The previous conference did almost like big picture stuff, which is great. I think that was like a great move. But then you have these certain types of communities that are still on government programming, having to buy certain foods because it's cheap. So it doesn't matter if there's a label on it, if they can't afford to be able to provide or buy some of that stuff.
And even after increasing access to healthy, affordable food, Hamilton says there's still an educational component that needs to be taught. She can see through her own career how a healthy lifestyle can only be achieved if you have the knowledge to sustain it.
Even people after they get the surgery, they're almost not being taught foundational tools, which is, for me, behavioral tools from brain, mindset, and genetics. It's like those common things. Surgery doesn't fix that. Medications don't fix that. They're foundational pieces that unfortunately is not being taught in the med schools. They're not being taught to our nurses. They're not really being taught by the providers who are providing this care.
Which means many patients go right back to their unhealthy habits.
I think providers need to understand how the brain really works with the body, in the sense that the brain commands everything, and then be able to educate their patients on how to rewire some of these, what I call like mindset changes, so people can have better success. Like, I can't just give people a surgery or a medication or make them change their diet when they have these inherent wired connections that's wanting them to do a certain thing.
Hamilton says in order to create a real change, we need to shift our expectations of healthcare.
We were taught, see the problem, treat the problem, right? We need to be taught, understand the problem, see the contributors, and then treat the patient. And we are not taught like this in traditional medicine. It's like, oh, you have heart disease, let's treat the heart disease. Oh, you have diabetes, let's treat the diabetes. My question when I see patients, I'm like, what are the contributors? What caused them to get here? We need to start treating that.
Unfortunately, Hamilton says that many people aren't ready to look at health in this way. Both patients and doctors usually want a quick solution to the problem at hand. However, a quick fix won't impact any of the underlying causes in our daily lives. Stein says many of us look at our health in a vacuum, meaning that we alone have control over it, except that's not reality. Think about all of the times you've sat next to a stranger on a bus or a plane who can't stop coughing.
Now, all of a sudden, you're out in the world, right? You don't work alone. And you say, oh, well, that's a problem. My person next to me is coughing on me. And so that person's health is influencing my health. So the fact that you don't totally control your health is very apparent when you're sitting next to somebody coughing on the bus.
Stein says we need to expand our view of health to realize it can be manipulated by outside forces we have no control over. Public health even includes events many people don't realize, such as school shootings.
The kids who were killed in that school were healthy, and yet their health was all of a sudden at the hands of a person who wasn't healthy. Or your aunt is driving along and she's killed by a person who's drunk. Well, their behavior of drinking heavily led to your aunt's death. Again, out of your control. This idea of it's all about me, it's all about the individual starts to fall apart.
But if parts of our own health are out of our control, how do we stay protected? Stein says the answer lies in politics.
And that's an odd answer from a doctor. But the truth of the matter is that the people who are making decisions about our health and our public health system and how we deal with alcohol and measles and school shootings are politicians. They are our health officers at this point in time.
Meaning that we can influence change through voting. Stein believes we should vote for people who are going to protect our health through policies and funding. That means more events like the Hunger Conference, but also more resources for education, housing, and for other factors that many people don't realize affect our health and safety. Stein wants people to rethink our views of health to include the community around us.
I want them to think about health as more than going to the doctor, that they live in the world of water and air and food and poverty, and to think about whether they want to be involved personally and spend some time working on any of those issues, or whether they should vote around some of those issues. That's what I want people to do. I want them to understand that the conversation needs to change a little bit from just being a conversation about me, to a conversation about us.
And if we're able to accomplish this, both Stein and Hamilton believe we can start to truly reverse the health of America, no matter how long it takes.
I may not even see it, unfortunately, in my lifetime, but my goal is at least to start a movement in this. Help people realize we're focused on the wrong thing, for one, and help people make what I call like this perspective shift.
Stein's book, Me versus Us, is available now wherever books are sold. For more information about Drs. Franchell Hamilton and Michael Stein, visit RadioHealthJournal.org. Our writer-producer is Kristen Farah. I'm Reed Pence. Coming up next week on Radio Health Journal.
Really, since the 70s and 80s, it's become probably one of the most serious global crises that we're not talking about.
The rising death toll caused by antibiotic resistance.
Then, how can you stop negative thoughts from controlling your actions?
We fail on our New Year's resolutions, not because we can't do it, not because we don't have the right intentions, but I believe it's because our mind and our emotions get in our way.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
Less than 10% of borrowers owe $100,000 or more, but they owe about a third of the outstanding debt.
Sadly, there's no one-size-fits-all solution to solving the higher education debt crisis. Then,
to think that New York, since 1790, has been the largest city in the country, remains the largest, but there's a reason for that.
The endless allure of New York. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at RadioHealthJournal.org. Join us again next week for another edition of Radio Health Journal.